My OBGYN was a 67-year-old man, and he said, "I'll test your hormones, Miss Gourley. Pretty sure you're a perfectly functioning female. You're just a PMS bitch."
He did not say that to you.
Yes, he did say that to me. So many women end up on my door just completely being gaslit. Like, this is just normal symptoms of aging. You're just a PMS bitch, things like that. It's just actually, it's bordering on criminal the way women have been completely left out of the medical system, really. I mean, all of modern medicine is really based around men.
Today, I have a very dear friend and mentor of mine, Shauna Gourley, who is a functional health and human potential coach who works with women and men worldwide to optimize their health, their resilience, their vitality. But she has a special focus on supporting women through perimenopause and menopause.
So what's kind of wrong with the system still to this day is now women are all going to get hormones, and the doctor's throwing them on hormones, but they're not looking at anything else, right? How are they metabolizing the hormones? What are the genetic predispositions to how they metabolize those hormones? I mean, the list goes on and on and on and on. It really is just all about education, all about knowing yourself really, really well, because every woman's going to be different, and every woman should not be getting the same prescription. And you should really learn and listen to your intuition and listen to your body.
So let's talk a little bit about how someone knows whether they might benefit from HRT. Hey there, sisters. Welcome back to the Period Whisperer podcast. I have a very extra special treat for you today. As you know, this whole month has been all about hormone replacement therapy, understanding your hormones, how to advocate for yourself with your hormones. And today I have a very dear friend and mentor of mine, Shauna Gourley, on, who is a functional health and human potential coach who works with women and men worldwide to optimize their health, their resilience, their vitality. But she has a special focus on supporting women through perimenopause and menopause. She has so much experience. She's someone I've gone to a lot for support as I have developed my own skill in this area. So you're getting the best of the best today. And today we're going to dive right into hormones. So Shauna, thank you so much for being here, and welcome to the Period Whisperer podcast.
Oh my gosh, Bria, I can't thank you enough for having me on. As you know, this is my passion and purpose in life. So I'm super excited to be here. Thank you.
Oh, this is wonderful. And as I always like to start the podcast with the guests, for you to tell us a little bit about you, about your story, about how you got here, why you love it. Yeah, what your journey has been through perimenopause and menopause, all those things.
Oh God, well, how much time do you
have? No, 5 minutes.
Okay, well, let's go back to a time that probably your audience members can relate to. So I had actually had my kids a little bit later in life. So I had my first daughter at 37 and my second daughter at 39. After which I just didn't seem to recover, like I quit sleeping. I started to develop food sensitivities. And quite honestly, I just went to pieces. Like, I fell apart, when you're not sleeping and you've got two little ones under the age of 2. I was running a home-based business. I was training for a triathlon, because isn't that what all of us crazy women do, right?
Everyone listening is like, oh my God, is this me?
Yes. Because this is what we're taught, right? You can do all the things, you can be all the things, and it's just not true, because there comes a time when your body will just say, sorry, this is not happening any longer. So I started to wake up and there were like clumps of hair on my pillow, which for a woman, we care about our hair.
Yeah.
And, I just started, honestly, this is hard to say, but I want other women who might be going through this to understand, like, I started to feel rage towards my children. Now, obviously, it's not something I acted on, but I just felt like, I had one nerve and my babies were standing on it. And all I'd ever wanted to be in life was a mother. And so to have this happening, I just thought, this is not right. This can't be right. So, I did what most people do. I made my rounds through my general physician in Canada, and she was really great at the time. I mean, she did all of this testing, sent me to all of these specialists. I was diagnosed with MS. I was diagnosed with like you name it, there were all these diagnoses, but there was only one solution, which was here are some antidepressant medications, here are some sleep medications, here are some PPIs for your chronic reflux, and just on and on and on. And I just intuitively knew that it was something going on with my hormones. So she said, okay, I'll send you to an OBGYN who at this time, my OBGYN was a 67-year-old man and he was on his way to retirement. But I'll never forget this day because it was one of those pivotal moments in your life, right? So he said to me, and his hand was on the door, and he had a young intern with him at the time. And he said, I'll test your hormones, Miss Gourley. He's like, I'm pretty sure you're a perfectly functioning female. You're just a PMS bitch.
He did not say that to you.
Yes, he did say that to me. And the intern, I saw her jaw practically hit her clipboard and she put her head down. And I burst into tears because I was at my wit's end, and I had
Yeah.
literally just told him that I was feeling this rage and this like just I had no bandwidth left to do
Yeah.
the basics, let alone to just be a mother.
Yeah.
And so I left there and I was just beside myself. I cried all the way home and then I was furious, right?
Yeah.
I'm in my car and I'm thinking of all the things I should have said.
Ugh.
But you know what? If I had to do it over again, I'd send that man a thank you note because that was the pivotal moment that I decided that I needed to take my health into my own hands.
Ugh.
And I just started doing research, which unbeknownst to me, I have a knack for. And I'm just like a dog with a bone. I just started going down these rabbit holes and I started reading everything by Suzanne Summers back in the day.
Oh, yeah.
I used to tease that I was the brunette Suzanne Summers of the North. And
I love that. I loved Suzanne Summers.
I know what a path she created, man.
Yeah.
Rest in peace.
Yeah.
And so I started reading, doing all this research. I read a book at the time called Adrenal Fatigue, the 21st Century Health Syndrome, which of course just completely struck a bell. And then I finally found the one and only functional medicine physician in my city, and he ran some saliva hormone testing and did a full thyroid panel. And I'll never forget that day either because he came in and he said to me, Shauna, I don't even know how you're getting out of bed in the morning. He said, you have the thyroid profile, or sorry, the hormone profile of a 90-year-old woman,
Oh my gosh.
and your thyroid is completely in the toilet. Now, I had been to an endocrinologist at this point who, of course, only tested my TSH and told me my thyroid was fine. Meanwhile, every woman in my family is on thyroid hormone. I had all of the symptoms. Again, just basically being gaslit. So I burst into tears again, not out of frustration, but out of finally
Relief.
feeling
Yeah.
seen and heard. Yeah.
Oh my gosh. How old were you then?
I was 41.
41.
Yeah, 41.
Wow. And that obviously stoked a fire for you to want to probably help other women do the same thing.
Oh, it was a huge fire. And that was the thing. I thought, surely to God, I can't be the only person going through this. And
Yeah.
so, I mean, at the time I was in a field completely unrelated, of course. But I'd quit my job. I was actually on insurance, like disability insurance, because I could no longer do that job.
Oh yeah.
So I decided, well, where could I start? And I knew that nutrition, I mean, I had to change my diet a lot, obviously, back then. I knew nutrition was a big piece, so I went back to school and I studied, got a certification in holistic nutrition, and then studied FDN. And then, the rabbit holes just keep going
Yeah.
when you start doing this work in
You
clinical
really
methylation and
do.
nutrigenomics and on and on and on and on. So if I were in the classic medical world, I probably could have a PhD by now.
Yeah.
But here we are.
It's a funny thing as a practitioner, isn't it? Is it really you
Mhm.
start somewhere, you're like, oh, I know stuff. And then all of a sudden you're like, wait a second, I don't know this. So then off you go down this whole other research rabbit hole until you're like, wow, I knew nothing. And now I know so
Exactly.
much more. So
Well, and the more you know, the more you realize, the less you know, right? It's like
Yeah,
every client that comes my
it's
way
different.
is an evolution for me in my
Yeah.
practice and my learning. And the
Yes.
more evolved we get, the seems the more tricky clients we get. I'm now working with two cancer patients, which I had never intended to do, and yet here I am.
Yeah, that's amazing. Well, I'm so grateful for your knowledge and what you do in this world, and I'm really glad that you were a dog with a bone on your research. And I've learned so much from you, and so I'm excited to kind of lean in today specific to HRT and really I wanted to call this episode like HRT Unfiltered, so because I just think there's so much miseducation. Um, and confusion around it. So let's have this conversation. Let's talk a bit about, and maybe we'll just start with what have found to be the biggest misconceptions women still have about HRT today?
Oh gosh, I'm glad you said unfiltered because I might swear.
Unfiltered.
No, I'll try not to.
Unfiltered. You can swear. It's
Unfiltered,
okay. We're all right.
unfiltered.
Unfiltered.
Because honestly, it's something that really does, I get passionate about and I get my back up because so many women, as I'm sure happens to you, end
Mhm.
up on my door, just completely being gaslit. Like,
Yeah.
this is just, normal
Yeah.
symptoms of aging. You're just a PMS bitch, things
Yeah.
like that. I mean, it's just actually it's bordering on criminal the way women have been completely left out of the medical system, really. I mean,
Yeah.
all of modern medicine is really based around men. And I,
Yeah.
I used to say, if men had to go through what women had to go through at midlife and beyond, there would be a clinic on every fucking corner,
Yeah.
you know, because let's face it, they can barely handle a cold,
It's
I'm
true.
kidding. I digress. I'm teasing, of course. I love men and I don't mean to give them a hard time. It's more
Yeah.
about the way the
None of them
system
are listening to this, so it's okay.
that's very true. That's very true. So, I think that that's it. It's just been left out. And I mean, now we're making some real strides.
Mm,
Finally, we've had the black box warning being lifted from hormones.
yes.
Hallelujah. Better late
Tell,
than never.
can you tell people what that means for people who don't know what that means?
Well, for the longest time, women's hormones have had the black box label on them,
Hmm.
right? Meaning that they are, can cause cancer. And this all came out of a really terrible study by the Women's Health Institute in 2002, where they claimed that hormone replacement therapy caused women to have increased risks of cancer.
Mm,
Now, we know, of course, that that study now has been completely debunked from top to bottom. And what most women weren't told then is that this study was conducted on synthetic hormones, okay?
mm,
Now, synthetic hormones, the study was done on synthetic Premarin, which is
mm.
synthetic estrogen. Premarin stands for um, what does it stand for? From mare's urine,
Yeah.
right?
Yeah.
So basically, they're getting estrogens, conjugated estrogens from horse urine that they're then adding a bunch of other stuff to, and so that they can patent it, right? Because remember that the pharmaceutical industry can't patent that which exists in nature,
So you
right?
can't
So they
patent mare's urine. They
right,
have to add stuff to it.
pregnant mare's
Pregnant mare.
urine,
That's where the preference comes in. Pregnant
Premarin.
mare's urine. Yep, got it.
And don't even get me started on what they do to these poor horses to extract said urine.
Yeah.
Disgusting. Anyway, so it was done on Premarin and then also synthetic progesterone known as progestin. Now,
Hmm.
those two things, again, are completely different, right? So we have estrogen and progesterone receptors in all of our cells, right? And bioidentical hormones come in and they fit like a key in a lock or a puzzle piece, right? They'll come in and they just fit identically
Yeah.
into those receptors, right? And if they're synthetic hormones, well, they come in and they kind of are the same. So they'll fit into those receptors, but they got a bunch of things kind of hanging out left over that are technically drugs and chemicals that your body doesn't really know what to do with. But
It's a
they
great
block up
explanation.
those receptors, okay? Rendering them essentially useless for your own endogenous production of those said hormones, okay? So now you had a bunch of women who were going in for relief and getting these hormones, and they were getting relief. Now, the study, what the women weren't also told was that the study showed that Premarin on its own, so just Premarin, so just the estrogen, there was no significant risk to increased cancers. It was the combination of the Premarin and the progestin, so both synthetic hormones, the combination of the two increased the risk for cancers, gynecological cancers in particular, by I think it was 0.1%. So the whole world went off hormone replacement therapy.
Yeah.
And then women were, of course, feeling like shit and losing their minds and just, being prescribed. Well, so get away from prescribing those two hormones. Now we can prescribe what? Sleep medication,
Yeah. SSRIs.
antidepressant medication, anti-anxiety medication. I mean, the list is endless for the number of prescriptions that would have to take place of being on HRT, never mind BHRT.
Yeah.
Okay. So that to me is probably the biggest injustice that women have been served in the last 50 years, 100 years. I don't know how long.
I couldn't agree more. I was just talking to my mom this morning about how she said, I was in surgery having a hysterectomy when that study came out. And I mean, all of a sudden, what do? You come out and everyone's telling you you can't have this or you shouldn't have this or it's going to cause cancer. And then you just damn suffer. So I
Exactly.
agree with you. And so what do we know the research to say about breast cancer risk and the safety of modern BHRT, I guess we'll call it.
Yeah. Well, everything comes with a risk,
Of
right?
course. Yeah.
And so as a woman, you really have to do your own research. And this is what I help my clients understand as well. But you have to weigh, right? There's risk to everything, and you
Mhm.
have to sort of understand your own family history. You have to understand your genetics. You have to get the proper testing. So what's kind of wrong with the system still to this day is so now women are all going to get hormones, and the doctor's throwing them on hormones, but they're not looking at anything else, right? How are they
Yeah.
metabolizing the hormones? What are the genetic, predispositions to how they metabolize those hormones?
Yep.
Do they have MTHFR markers? I mean, the list goes on and on and on and on. So it's a big question
Yeah.
and it's a bit of a convoluted answer.
Yeah.
But I would say that the health benefits far outweigh the
The
risks.
risks.
Yeah. As a woman, just as we age, the benefits are, preventing cognitive decline. I mean, one of the biggest markers, and women have far greater risk for things like Alzheimer's and dementia, right? And
Mm,
as we age, and the reason for that in particular is estrogen, right? So our
mm,
estrogen levels just decline, and that hugely increases our risk for those cognitive impairment diseases
yeah.
out of the gate. Plus, they protect our hearts, they protect our bones, our bone
Mhm.
density, our stamina, our energy levels, our sleep. I mean, the list just goes on and on and on of the benefits. Yeah.
Yeah, I totally agree. It's unbelievable. And I'm so grateful that they removed that box finally. I feel like that was a lot of work and a lot of lobbying by a lot of people, especially women,
Mm.
to get there.
Oh
But
my gosh.
the generations before us who suffered, let's talk a little bit about how someone knows whether they might benefit from HRT, especially if they're still cycling.
Yeah. If you're still cycling, much like I was at 41, I mean, you just start to know that things are off,
Hmm.
right? Your sleep starts to suffer, your mood starts to suffer, your libido starts to suffer, your energy levels decline. You can start to have memory lapses. I mean, your hair can start to thin. I mean,
Yeah.
you can be eating the same way and working out the same way, and now all of a sudden you're putting on weight.
Yeah.
Now all of a sudden, you have some weird gut issues. I mean, just it just kind of goes on and on. But you have to really just sort of trust your intuition. I think that's one
Mm,
of the biggest things that women have been gaslit on,
totally.
is like, I know my body and I know how it feels. And I know now that something's wrong. Like I deeply intuited that it was hormonal,
Yeah.
and yet I was sent to all of these specialists, because allopathic medicine compartmentalizes the body, right?
Hmm.
So, I was sent to a neurologist because I was having carpal tunnel, which is a classic sign of hypothyroidism if anybody else is suffering with that. So,
Yeah.
but instead I went to this neurologist who, oh no, you've got MS. Really? Like, I don't have MS, I never did have MS. And kudos
That's
to me that I never
crazy.
believed the diagnosis. I was just like, what? This makes no sense to me.
That's
And
wild.
it is wild, and then I was sent to a gastroenterologist because, of course, I was having all of these,
GI issues.
I was diagnosed with IBS, right? Which again, when you're hypothyroid, what's one of the first things that starts to happen is your hydrochloric acid production starts to go down, and then you can't digest things anymore. And, that puts pressure on the lower esophageal sphincter, and then you start having reflux, right? So, well, here's some PPIs for that,
Mhm.
you know. Yeah, sorry, I got on a
No.
tangent and I forget the question.
No, I was saying, how do we actually might know,
Yeah,
if you're still cycling? Because I think it can feel obvious if we no longer have a period and we've
yeah,
achieved that year of menopause. We know our ovaries have retired.
shut down.
And
Yeah,
so we could potentially benefit from it. But for those of us cycling, and this is where I hear a lot of my clients get dismissed, is they still have a period, they don't
yeah.
feel right, and they can't even get their doctor to test their hormones, let alone, or they have people that just prescribe hormone replacement therapy without
No testing.
testing the hormones. It drives me crazy. I'm like, how does that make any sense?
It's wild. I know I just had a discovery call right before I got on with you. Same thing. They had given her a full hysterectomy at 35,
Oh gosh.
had done nothing since, and now they're just kind of throwing hormones at her when she had the reason they gave her a hysterectomy was because of endometriosis, which is classically estrogen
Estrogen
dominance, right?
dominance.
And now they're just throwing more estrogen at her, and now she's gained like 50 pounds in
Right.
the last
And we're
year. And
not
she's
detoxing our estrogen.
exactly.
It's
So back to the perimenopause thing. So your periods will start to change. And sometimes it's just a subtle thing, right? Like maybe they become a little shorter, maybe
yeah.
they become a little longer. Like if you should be tracking your cycles, I think most women are now.
Yeah.
Or they become a little scant, or they become heavy.
Mm-hmm. Spotting. Mm-hmm.
Spotting, like you can have ovarian pain, when you ovulate, you
Manipulate.
can start to feel that pain sometimes. I mean, there's a multitude of symptoms.
Right.
Yeah.
In other words. And I love that you said it's really important to listen to our intuition. And for the women listening, I think it can feel hard to do that because not only have we been told not to listen, but we've literally been distracted from listening to our body, haven't we, for most of our lives? So it's almost like we don't even know how to pay attention, let alone trust what our own body is saying. So it's a
Oh,
practice, and I think the more you work at it, the more you start to become fluent in that language. But I mean, I think one way to look at it, I always look at it like if you're doing the same things and nothing is working and someone's telling you you're fine and you're not fine, there you go. There's your flag. That's it.
yeah.
Something's not right.
Refuse to be gaslit. And I love that you said that about your intuition because it really is, it's something that women have. It's our greatest gift. And you're absolutely right that it's the thing that we have been taught to ignore, right? Where
Yeah.
that's part of the thing, right? I mean, that's why I told the story about like we're not just small men,
Hmm.
you know? So, I mean, and I love women's liberation and everything that it's allowed us to do. And I fully believe a woman should be able to have a career and be a mother and all of those things. But I feel like it's partially what's hurt us,
Yeah. Well,
because
no one
we're out
stepped
there in
in
the
to help
world.
us.
Yeah,
We
exactly.
you just do it all if you want it all, but no one's going to help you do it all if you want it
Right.
all.
Right.
That's what it feels like,
I mean,
doesn't
I
it?
think what did Gloria Steinem say? She said, women will be truly liberated when men say, I can have children and do it all. Like the same kind of thing. Like they just don't
Yes.
understand that, like
Yeah.
because we're still doing the majority of the childcare. We're really doing the majority of looking after our parents, like a lot of
Yeah.
us are caught, especially in those perimenopausal years,
Yeah.
between raising children and having elderly parents, right?
Yeah.
We tend to take on those caretaking roles.
And attempting to have a career that's probably around coming into peak season at that time for sure, and the
Yeah,
emotional labor of your life. I
yeah,
don't know many women in heterosexual relationships who aren't the ones responsible for knowing all the school trips and all the doctor's appointments and the dentist appointments and the birthdays and wrapping all the Christmas gifts of everything that we just did and thinking of all the gifts. That's why there's all these hilarious memes out there around this season
yeah,
of
yeah,
like, oh, I wrapped my own gifts and put them under the Christmas tree. I mean, it's funny,
precisely.
not funny.
And then there's the whole, mommy wine culture,
Oh,
right? Like
yeah.
let's just suppress all of those feelings and emotions and
Yes.
symptoms. Let's just numb everything out,
Yeah.
right?
And that did a whole other number. I like that you brought that up. So let's go back. I loved when you talked about, I want to go back to talking about testing before you go on hormone replacement therapy because
Mhm.
and I think this is probably why some women can feel incredible on HRT while others feel worse, is because we need to understand that it's not just about adding more hormones to the picture.
Yeah.
So for you in your practice, what tests do you recommend women definitely get
Yeah.
before accepting that HRT is a good option for them?
Well, in my practice, as you well know,
Hmm.
it's really there are three things we look at. We run a Dutch test, which is the dried urine test for complete hormones,
Yeah.
which not only shows us the level of hormones, but as mentioned before, how we're metabolizing those hormones,
Yeah.
right? Because that's the key right there. So, and that will often tell us why you're not, doing well with those hormones, which was my case. I mean, I found out much later that genetically I'm a poor metabolizer of estrogen. And I found
Mm.
that through the Dutch test, right? And through genetic testing later,
Hmm.
that I had CYP markers, which are part of the phase one estrogen detox pathway. I also had COMT markers, which were part
Hmm.
of phase two, and I was a shitty methylator. So I had all these sort of things against me.
Yeah.
Um, and I also found out I had a non-celiac sensitivity to gluten, and so my gut was a mess. So the other thing, of course, we look at is full gut testing with the GI map because
Hmm.
a lot of estrogen detox can happen through the gut as well as the liver. So we want to make sure your gut is able to take care of those hormones. We want to make sure your liver is able to take care of those hormones. So
Yeah.
those are the two. And then we also do really comprehensive blood chemistry to, again, have a look at methylation, many markers for inflammation, because that's important. Many women, their blood sugar levels start to get wackadoodle, when the hormones start to fluctuate. So we want to have a full blood sugar panel.
Yeah.
We want to have a full thyroid panel. I mean, that was my big issue, right? My thyroid was completely tanked. And when that happens, you're going to see women whose hormones are just like boom in the
Yeah.
basement, like right away. And it's very common for that to happen right after we have children.
Mm.
Yeah.
Which is fascinating, right? Because we're seeing more and more women having children later in life, getting closer to
Yeah.
this, this time where the ovaries are like, well, I'm going to think about retiring these days, So it becomes really challenging and nobody's talking about it.
Very true. And you know what? We know that at around age 35, we're sort of mm, genetically, we just kind of start to decline our production of progesterone, right? So we
Yeah.
always want to have a balance between estrogen and progesterone. And so naturally, so that's the thing for a lot of women, especially women who are having careers and working, the stress levels are up to here.
Yeah.
That progesterone can really start to decline very early on, meaning we can start to enter perimenopause at 35. And I'm even seeing it earlier than that
Yeah.
now, which is crazy. Yeah.
Yeah, it is crazy. I think obviously because of the stress and just the productivity load in life and the toxins in our world. I love that you brought up kind of the MTHFR gene, COMT. Can we talk a little bit more about that? Because these are not as familiar, I think, to women. I mean, as you and I might think of them as, because we talk about them more frequently, we see them more frequently. But what do you
Mhm.
think women need to know about genetic factors like the MTHFR gene COMT or detox capacity before starting HRT?
Oh gosh, so important. Because again, when I early on in my practice, I worked with functional medicine doctors, and even more recently, like about 5 years ago, I was working with someone, and they were just kind of having these droves of women come through the practice, and they were just putting them all on this sort of standardized, this much estrogen, this much progesterone, this much testosterone, and follow this diet,
Mm.
boom, and just kind of hurting them through, right?
Yeah.
Um, and I actually lost that position because I I was just like, what? You're not running a Dutch, you're not running GI map. And these poor people, some of them, like you said, those who came in that were healthy and were living a reasonably healthy lifestyle,
Yeah.
sure, they layered on those hormones and they did well.
Hmm.
Um, but the rest of them, oh my gosh, they got exponentially worse. And
Jeez.
this is why, right? Because now you're having this backlog. So without the Dutch and not without seeing, that phase one, those CYP markers
Yeah.
showing us how we're metabolizing our estrogens, you get this backlog and you just start to produce too much, or it's not even able to get into the receptors. I mean, there's just
Yeah.
a myriad of things that can go wrong. So the CYP is the sort of first phase one, and these are all phases that happen in the liver. So that's the other thing, a woman can have a very congested liver. Um, I'll say quickly that my mother is a breast cancer survivor, and
Wow.
she was on the deadly Prem Pro.
Okay.
But she had been prescribed sleeping pills for over 40 years. And so, needless to say, her liver was very congested, and she'd had elevated liver enzymes for like a decade.
Oh my goodness.
And she ended up with breast cancer. And I mean, not surprising when we
Right.
think about that, right? So now I know, of course, I'm a poor methylator and a poor estrogen detoxer, and obviously my mother likely was as well.
Right.
So there's the phase one is about the CYP, and then phase two is more about COMT and methylation. And we can see those pathways on the Dutch very, very well. And then
Yeah.
we can confirm them with, comprehensive blood chemistry and also with running, DNA panels. For many of my clients too, I run a nutrition genome panel where we can see sort of all of the markers for CYP and for
I like that.
COMT and for all of these things. So I mean, I've been a clinician long enough that I can look at a Dutch and just know and look at the blood chemistry and
Yeah.
yeah, your methylation's not happy.
Yeah.
This is expressing and this is expressing. But many of my clients want to have a really full picture and they really want to take full control. And so that's another option as well that we do nutrigenomics and clinical methylation testing as
Oh,
well.
I like that because it sounds like what I'm hearing you say is that if we are not methylating properly, if we have some of these issues in phase one or phase two detox, then taking hormone replacement therapy is going to be the reason that we start to feel worse. It is going to start to
That
express
they
and that they may feel worse.
Exactly, that
Yeah.
they may not work for you. And we need to understand that 40% of the population has methylation genetic variants, right? That's a
Hmm.
really high
It's
amount in
massive.
the general population.
Yeah.
And that's just talking about MTHFR. I mean, there are multiple other things that can affect your estrogen detox, right?
Yeah.
So getting a full panel is really, really worth it, and getting someone who can interpret those results for you
Right.
too.
Better understand that for you.
Yeah.
I love that. Let's talk a little bit about what types of hormone replacement therapy are bioidentical. So obviously we know bioidentical hormone replacement therapy is the preferred method that we want to be using because it fits like that glove, which I love there, that key in the lock, like you said.
Hmm.
What are the types that you find work best, like in terms of, yeah, pill, patch, creams,
Yeah.
things like that?
Obviously, every woman's going to be different, and
Yeah.
it's a lot of it, some of it is preference, some of it, are sort of the studies say. Um, and my own functional medical doctor who prescribes my hormones, she loves transdermal or patches for estrogen
Yeah.
because she says they deliver the most consistent amounts, which is
Mm,
really what you want because it's those fluctuations in estrogen that can really kind of wreak havoc, right? You can,
yes. On our
especially
mood.
if you're sensitive.
Hmm.
Yeah, if you're sensitive, like you can really feel that drop in estrogen and or the increase. And when you have these genetic variants, the other thing we have to learn is our own bodies. Like I can tell when I'm starting to get too much estrogen and I can tell when
Hmm.
I've got too much progesterone, you know what I mean? So then we have to sort of tweak them that way too.
Yeah.
But I would say, it depends on your preference. I personally like the patch because of the consistency.
Yeah.
Now you do have to find the right dose, right? Usually they start you on a low dose. And if you tend to have some of these genetic variants where you don't metabolize your estrogens well, it's a little better to stay on a bit lower dose. I know a lot of people are super, as rah-rah and like to just give you this big, 1 milligram kind of thing. And I would suggest if you know that you have some of these genetic variants, it's better to start low and then sort of increase. Like I myself, that's sort of how I've worked it, that I stay on a bit lower dose, or if I go on a higher dose, then I know that I have to take supplements that are going to help me metabolize those estrogens in a healthful way, right? So there's a lot of
Yes.
tweaking that goes on. So for some women, they prefer a cream, they prefer a compounded cream,
Hmm.
and that's easy to adjust as well. I mean, you can do a half a pump or a full pump or, whatever your prescription tends towards. And then, just kind of knowing the signs of when you're getting too much or, I mean, and clearly, if you're drinking a lot of alcohol, because it's
Mm.
our liver that has to do that work, you got to be really aware of that because now all of a sudden your liver is going to have to deal with this toxin and it is no longer able to deal with the hormones. So a lot of women run into problems with that too, right? So we have to be very, very aware and very careful.
I love that. Maybe we should talk real quick about best practices. If you're on hormone replacement therapy, are there some best practices? It sounds like maybe not drinking so much is one of those.
Well, certainly. And knowing, first of all, get the testing done, know
Yes.
your predispositions. So
Mm.
just because you have these predispositions doesn't mean you're not a good candidate
Yeah.
for hormone replacement. It just means you have to know
How to
how
support
to
it.
manage it, right? How to
Hmm.
support it. Exactly. And then you have to be very mindful of your alcohol intake for certain. It just messes with your liver. Like I said, just immediately your liver has to take over dealing with this toxin, poison, which is what it is. It'll prefer that rather than having to worry about, you being able to procreate. That's not a big thing right now. First of all, we got to take care of these toxins over here, right?
Yeah.
So that's a big thing. You have to be mindful. And the culture is very much, just to sort of numb and drown and distract. And
Yeah.
so to come in, and just see your doctor and get a prescription for hormones with sort of out understanding that you need to have a healthy liver and a healthy gut and
Yeah.
healthy sleep, good sleep patterns, good diet, all of these things, a good amount of exercise, um, really, really important. And we haven't even touched on, stress and cortisol and all
Oh, I
that stuff
know.
and how that just will throw everything off as well, right? So,
Yeah, it's one of these things where these foundational pillars of health are so critical in order for anything to even work, in order to build health upon that, and then be able to
yeah,
use, amazing tools like bioidentical hormone replacement therapy. We have to have these foundations, and then we need to know our numbers, like you're saying, and
yeah,
then we can get into how to get the most out of these tools that I think we should be using if they're right for us. Um,
a
Quite,
thousand percent.
yeah,
My motto really is, we live in a time where our lifespan has increased dramatically, right?
yeah,
And if I'm going to live to be 100, I don't want to just be alive for the sake of it. I want to be alive
thriving.
and thriving and
Yeah.
healthy and moving, like I don't want to be sat in a chair. No, thank you.
Yes.
So, I mean, that's the thing, right? So it really is just all about education, all about knowing yourself really,
Yes.
really well and your own self,
Yeah.
because every woman's going to be different and every woman should not be getting the same prescription. And you should
No.
really learn and listen to your intuition and listen to your body because those symptoms are really just, I call it the medicine under the medicine in my
Mm.
practice. They're really this deeper aspect of yourself trying to let you know that, hey, there's something not right here. You need to pay
Yeah.
attention, you know?
I totally agree with you. I've come to really think of our body as a woman, as just another child. We're so good as mothers at, and
Mm.
as pet mothers and human mothers at knowing when our child is, something happened at school or something's a little off or they didn't eat enough or they didn't sleep enough or are they this, like we know this so well. And
Yeah.
it's really important that we start to pay attention to ourselves the same way because that is, I think, how we get to thrive is by
It
loving ourselves and knowing ourselves.
so massive, Bria. I mean,
Yeah.
such a huge part of my practice because again, I've had clients who come in and they are eating all the right things, taking
Hmm.
all the right supplements, on the hormones. On
Hmm.
paper, it's like, what's going on here?
Yeah.
Everything looks pretty good. And yet they're still really struggling. And
Hmm.
oftentimes with women, I wrote a piece on my Substack recently about this because it was my own story about sort of early, childhood trauma and
Hmm.
how it makes us become hypervigilant. And when we've
Yeah.
spent a lifetime being hypervigilant, we just have the central nervous system that's just kind of wired for, fight or flight and
Super sensitive to it.
super sensitive. And if we haven't really dealt with those childhood traumas, like
Yeah.
you said, knowing yourself, loving yourself, and so many of us defer that, right? It's like,
Yeah.
no, I'm going to take care of this and I'm going to people please over here and I'm going to
Yeah.
do this and I'm going to do that. And
Yeah.
really, so that's the really, again, the missing piece, from
Hmm.
functional medicine and mainstream medicine is
Yeah.
really, getting into that somatic release, whether you
Yeah.
find a breath work practice or a yoga practice or some kind of thing, a therapist.
Yeah.
I'm my own practice work, help clients who work with psychedelic medicines. I mean,
Yeah. Oh, yeah.
whatever you find to
That
help
works for
you
you.
get into those recesses and clear them out. I mean, it's just absolutely life-changing.
Yeah, I agree. It's one of the intangible aspects of healing that is really challenging to overcome if we can't look at ourselves enough, or sit in stillness with ourselves and be okay in those moments. I think that's a really clear sign that it's time for you to do some deeper work.
Absolutely, because we're taught as a society not to sit with those things. I mean, the
Yeah.
standing joke is, well, there's a pill for that, you know.
Yeah.
Why do you want to feel those emotions? Why do you want to sit with that? Like,
Yeah.
no, no, no,
Yeah.
no. Yeah.
This has been amazing. I have a few more quick questions because I'm,
Yeah.
I'm so curious. What are your thoughts on women who've had a hysterectomy being told that they don't need progesterone?
Oh my God. Don't even get me started.
I've had so many
Um,
people say this to me lately. I'm like, what? My mom said this to me about, I'm like, what? I'm like, estrogen needs progesterone. That doesn't make any sense to me. I don't understand.
so as I mentioned, we have estrogen and progesterone receptors in our cells, and progesterone is the calming hormone. I mean, it helps us sleep. I can't even, no, 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 I'm having a blank moment here in terms of progesterone, but in terms of breast health, okay, so okay, yeah, you don't have a uterus anymore, but you still have breasts, right?
Mm-hmm.
So if you think about the way that estrogen works in the body, so estrogen and testosterone are proliferative hormones, right? Meaning
Mm-hmm.
they cause tissue growth, right? And progesterone comes in and is a counterbalance to
Mm.
that proliferative
Ration.
hormone. So it helps the uterine lining shed, right? It's
Yes.
highly involved in apoptosis, though, right? Which is cell death. So all those old cells that we don't need anymore that slough away.
Yeah.
Progesterone is highly implicated in that process, right?
Mm.
So when you think about it, if you have estrogen unopposed in breast tissue and you start to get proliferative growth in a duct, for instance. So many of my friends I know have been diagnosed with DCIS, which is ductal carcinoma in situ, which is where a little milk duct starts to grow because we have or estrogen that's unopposed in the breast tissue, right?
Jeez, that's
So
crazy.
that in and of itself can lead to breast cancer. Like, hello.
So
So
yes,
we
you need progesterone.
You'll need progesterone
You
for
need
that one reason. If that one reason isn't enough, there's a million other reasons that aren't coming to top of mind right now.
right,
But there's
right.
so many. I have a good article I can send you about that
Oh, I would love that. And I can link it in the show notes here.
for sure.
Um, for women who are cycling and maybe who are like you, where maybe they, something happened so early where they were completely depleted. Like, was there ever a time where you didn't need to be on hormones anymore, where you got your body back making its own hormone? Or like, if we are still cycling and maybe we need some hormone replacement therapy and can benefit from it now, does it mean we always need to be on it?
That's a really great question. And I kind of view hormone replacement therapy like any other deficiency, whether it's nutritional or whatever. I
Hmm.
mean, for me, so the way what happened for me was because I was predisposed to hypothyroidism, primary type of hypothyroidism,
Yeah.
that huge, big drop in progesterone after you have a child, right?
Hmm.
So all the women, go through that horrible postpartum depression is part of it. So for me, progesterone is really supportive. Here's another thing going back to progesterone, super supportive of the thyroid. Okay.
Yeah.
So when that progesterone drops like that after childbirth, and then it doesn't quite recover because maybe you're a little bit older, like I was,
Hmm.
39, then you're going to start to have problems with your thyroid. So when your thyroid tanks, then if you're predisposed to that, right? Then downstream from that, all of your sex hormones are going to just
Yeah.
crash because your adrenals are now trying to make up the difference, right? So they're working hard. So your adrenals are crashing. I mean, I was in end stage exhaustive phase adrenal dysregulation at the time
Jeez,
too.
that's
So that's what
crazy.
happens, right?
Yeah.
So, so for me, getting on thyroid hormone, desiccated thyroid hormone, which is again a bioidentical type of thyroid hormone. It contains T1, T2, T3, T4,
Mm,
calcitonin, all the things like your own body would make. So the
yeah.
moment I got on that thyroid hormone, it was like this fog lifted, this brain
Mm,
fog lifted, my hair quit falling out. I started to sleep better. My mood improved. That, alongside some progesterone, was
hmm.
all I needed. That got me right through to 50.
Oh my goodness.
Yeah. So
From
progesterone, so
41.
just balancing out balancing out estrogen, progesterone, getting the thyroid back online, which for me required thyroid hormone, and I have zero issue with that. I'll be on that till the day I die, and I'm okay with that.
Yeah. Yeah.
Because even if your thyroid is a little underactive, I mean, it just predisposes you to so many disease states, including these other, hormonal imbalances, right? So
Yeah.
why not take a little thyroid hormone and get it back up to snuff? I mean, our thyroids are super sensitive to environmental toxins, to stress. I mean, my functional doctor will tell you there's not a person alive over the age of 70 who doesn't need thyroid hormone
Ooh,
support,
interesting.
just because we've lived on the planet for so long, right? So usually in the perimenopausal stages, make sure you're getting full thyroid panel, iron panel. Iron is important, right?
Yeah.
If your gut is leaky and you're not absorbing iron properly, iron is what helps escort free T3, which is the active form of thyroid hormone,
Yep.
into the cell, right? So that's a piece that's missed too.
Hmm.
So, making sure your gut is healthy, and then your thyroid is happy, and you're managing your stress, and then some progesterone, a little bit of progesterone in those perimenopausal years can go such a long way.
Oh,
Yeah.
I love that. So again, through all of this, what I consistently hear you saying is just, we need to pay attention to our own body. We need to make sure our gut is in check. We need to make sure probably our adrenals and our thyroid and our liver are in check. And we need to know our numbers before
Yeah.
we do any of these things.
And then
Um,
moving into my stage of life, which is
yeah,
postmenopausal,
yeah.
um, people ask me, well, how long can you stay on hormones? And my standing joke, as you know, is they'll have to pry them out of my cold,
Cold
dead
dead
hands.
hands.
Um, because why would I want to stop feeling good? Why, like, I mean,
Yeah,
I go to the gym, I train,
yeah.
I walk,
You
I have
take
never changed
supplements.
my
Yeah,
body. Like I want to feel this way till the day, my soul decides it's going to check out, you
yeah,
know?
yeah.
So for me, like I said, I'll be on them for a lifetime, just like I am many of my other supplements that I use on the daily or
Yeah.
at least regularly to sort of just maintain good health.
Yeah. To be the best version of you that you can be.
Exactly.
Um, Shauna, what do you wish every woman understood before speaking to her doctor about hormone replacement therapy?
Oh,
Last question. That's my last question, except for how do we learn
it's
more
a
from you?
it's a big one. It's a big one. Before speaking to the doctor, educate yourself.
Mhm.
Um, don't stand for gaslighting.
Mhm.
Don't let anyone gaslight you. Don't let anyone tell you that your symptoms are in your head or that there's something else when you know intuitively that it's hormone related.
Yeah.
Always get a second opinion. You
Oh,
know,
that's a good
if
one.
your doctor won't listen to you, then you're fired. Find someone who will.
Yeah, I pay you. Fire them. That's a really
Yeah,
great point.
yeah, yeah,
You
yeah.
don't have to go to that doctor. Well, it's challenging in Canada, as we know, but
Oh
certainly
gosh.
here in the US, you can fire that doctor and go to another
Yeah.
doctor.
Yeah, yeah, a good. I have such a heart for my clients in Canada.
Yeah,
It's tough. Yeah,
yeah, it's more
but
challenging.
hopefully we'll get there soon. You give me a great resource today. I'll be checking out for sure.
Yeah, awesome. Shauna, thank you so much. This has been such a delight. I could talk to you all day. And when maybe
I
one day I'll
know.
meet you in Mexico so so we can talk all day about it.
Absolutely, that would be amazing. It was absolutely my pleasure, Bria, and good luck with all your wonderful work that you're doing in the world.
Thank you so much. For any of the women listening who want to get into your world, who want to learn more from you, where do they go?
You can find me at shaunagourley.com. And I am also on Substack. I'm writing some articles just to help educate women around this.
Oh, I love
Again,
this.
at Shauna Gourley. I have a podcast called Life Less Perfect Podcast. There's the first season is out. I'm a little backlogged on the second season, but we'll be getting there soon.
Go binge it, and then
Yeah,
then it'll
yeah,
be ready for
exactly.
you. I will put
Exactly.
all those links in the show note. Thank you again so much, Shauna.
Wonderful. Thanks, Bria. Have a great day.
You too, sisters. Now you have so much more information on how to stand up for yourself, how to know more about your body, how to listen to your body from one of the best. So go out, be more in your lives and not just less on a scale. We'll catch you in the next episode.